The White House wants you to wait to learn about the marketplaces? What? Are they serious? Hi, I'm Joey Giangola with Giangola Insurance Agency. In this week's Health Insurance Break, we're going to talk about why you need to learn as much as you can, as soon as you can, about the upcoming marketplaces and all the changes surrounding the Affordable Care Act. So I was looking for a topic for today to bring to you to, let you know something important about health insurance for our weekly little chat here. And I was alerted to an article by the Washington Post that had said that the White House has made a conscious decision to hold back its outreach efforts. Well, actually, hold on. Let me read the direct quote here. The White House has made a conscious decision to hold off on public outreach and education until right before open enrollment. I got a big problem with that, and I think you should too. Waiting until the last minute to deal with your health insurance is never a good idea, and more often than not leads to more problems that you don't need. There's two main points that I want you to take away from this, and I said it in the very first opening of the video here, is you're going to want to give yourself as much time as you possibly can and know as much as you possibly can about these upcoming marketplaces and what's going to work best for you. The reasoning behind the Obama administration's decision to hold off on this information is because their idea is there's no point in pitching a product until it's almost on the shelf. And that's great. I mean, if you're buying a beanbag chair, let's get serious right now. This is health insurance. This is the thing that is supposed to protect you from one of, if not the most significant financial emergency you could ever find yourself in. But hey, you only need a few days for that, right? It's not that big of a deal. The more I think about this, the more I talk about it, the more upset I get. We've been going back and forth for how long? Several years on the importance of health insurance and why we need reform in this country. But yet we have a piece of legislation that was passed that's so confusing that people like me, people that have been doing it for even a lot longer than I have, are having a hard time making sense of it all. If it's so important, we should honestly just sit down and give it the respect it needs and deserves. There's a guy by the name of Kevin Walsh. He's a top-level executive at Xerox, and he is an influential part of creating Utah's health insurance marketplace. And he shared a diagram kind of outlining, illustrating, if you will, how complex of a process it is creating these marketplaces for you to buy from. And if you take a look at it right here, if it's that confusing for them to sell you health insurance, don't you think that you're going to have a little bit of your own homework to do in the process? I went ahead and created my own little diagram, if you will, to show you how simple I think it should be and how simple it can be if we were to work through this. And you can just take a look right here. It's that easy. Now, I'm not saying that I'm going to be able to solve all of your problems, but I am telling you that if you talk with somebody, if you start handling this at the appropriate time, you're going to be in a much better place than you were if you were to wait until the last minute, until the product is almost on the shelf. The reason that you're going to want to do this is because two main things. One, you're going to have a decision, a choice to make. Do you buy inside or outside of this marketplace? You got to first identify that. And you can do that in a lot of different ways. And part of that has to do with your ability to qualify for tax credits and subsidies. That's going to be the main driving force to deciding whether or not you go and buy a plan from the marketplace or you decide to buy it elsewhere. Your second one is your affordability. If you don't qualify for those subsidies and credits, well, your health insurance could potentially be significantly more expensive than you're experiencing right now. Better that you know that now and have 6, 7 months, 100 days to prepare and maybe put a few extra bucks aside each month now, knowing that your health insurance may cost you significantly more. The bottom line, that's why you're not going to want to wait until the last minute. You're going to want to make sure that this is handled well before that 100 days is up, well before you see this big outreach coming, whatever they're going to do. You're going to want to make sure you're starting right now. And that's why I'm so excited to announce that today we're going to be releasing our very own guide on how to understand Ohio's health insurance marketplace. This is going to walk you through everything that you need to know, those subsidies, those credits, and things like that. It's going to answer all those questions for you if you qualify. It's also going to walk you through step by step how you actually even apply of all that information. So you're going to want to go ahead and download that. There's a link below in this video's description. Of course, we do, in addition to that, have a blog post. If you want to read up a little bit more on this, link is in the video's description. Of course, I am Joey Giangola with Giangola Insurance Agency. Take it easy, everyone.